San Diegans accomplish great things every day. We care about our neighbors and our community. We are proud of our diversity. We are resilient. We hold our leaders accountable. We live in one of the most dynamic cities in America, the San Diego Union-Tribune, telling San Diego's story for more than 150 years.
SDCCU is an engaged community partner. Each year, SDCCU is proud to support many nonprofit organizations throughout Southern California. Our partnerships allow us to help shape the financial lives of many through volunteerism, financial support, and creating public awareness. The result is a big impact on the communities we serve. SDCCU, it's not big bank banking, it's better. Federally insured by NCUA. Find out more at sdccu.com.
Welcome to the 2021 San Diego Union-Tribune Festival of Books. Thank you for joining us. My name is Maya Trabulsi, and I'm anchor and reporter for Evening Edition on KPBS in San Diego. And I would like to introduce our authors for this panel. We begin with Nicola Twilley and Geoff Manaugh. They are authors of Until Proven Safe, The History and Future of Quarantine. We are also joined by Andy Slavitt, author of Preventable, the inside story of how leadership failures, politics, and selfishness doomed the U.S. coronavirus response. Welcome.
Thank you. Thanks for having us.
Nikki and Geoff, I'm going to start with you because your book really describes quite the adventure that you took all around the world, diving deep into the history of quarantine, which is not only applied to people suspected of illness, but also plants, hazardous materials, such as letters and radioactive waste, for example. You describe how quarantine has been used as a tool to, as you put it, I'm going to quote you, create a buffer between the known and unknown, exposure and diagnosis, essentially buying us as humans time to figure out how to respond to a biological threat. Can you talk to us about how quarantine has been used and is still used, as you put it, as a spatial tool from another era?
Sure. Well, sure. As you hinted in your question, one of the things that really drew us to the very topic of quarantine is the fact that it's so different from just plain isolation. Quarantine requires us not to know if someone is infected. It requires us not to know if something is dangerous. We simply suspect it of danger, or we suspect it of infection. And so we seek a way to separate ourselves from that and put it into quarantine. And that's how we buy time to then expose ourselves to it later or to interact with it. And so I'd say that for centuries, quarantine is a practice that has first developed medically in response to the Black Death, and has remained at its core pretty fundamentally similar over those centuries. But it has expanded to, as you mentioned, be used to protect our food supply, to be abused at ports of entry, to separate some immigrants from others in the name of political suspicion rather than medical certainty. And you see it popping up, in all of these different industries and fields, which is why we thought it would sustain an entire book-length investigation.
Our thought really was that it had shaped the world around us in so many ways that people were not aware of, particularly because we started reporting this so long before COVID, when quarantine seemed like a thing from the past, even to some public health officials who told us, oh, you must be writing a historical book. We aren't going to see sort of mass quarantines in the future. We thought that we would, but we also wanted to show people how this one medical intervention had shaped where international borders are, had shaped the papers that we use to move around the world and kept our food safe, shaped planetary exploration, had really sort of transformed things without being much discussed.
And jumping down to modern times now, Andy, your book describes the layers of protocol that were either followed or ignored from the onset of the pandemic, leading to what you describe as failed leadership. Early on in the book, you talk about how your son's understanding of exponential math is useful in understanding how COVID propagates in our communities. And ultimately, that math points to how a 2-day delay in action against the virus puts us 1 month behind on containment. Can you explain that to us here?
Yeah, I mean, with the pandemic, the challenge with following science and scientific protocols is that there's a lot that doesn't meet the eye logically. The idea that one person could infect 5 people and 5 infect 25 and 25 125 is very different from how we're used to thinking. And we describe it in the book in ways that people understand it. It's like if you were swimming after a speedboat as fast as you could. Every time you looked up, the boat would be further and further away. So if you don't act quickly, you end up in real challenges. And so the willingness of political leaders to even acknowledge that we have a problem is critical in the early days. And the weeks and months that went by when President Trump was aware that we had COVID-19, that it was spreading and that it was lethal, and didn't do anything about it, turned out to be very, very costly in the context of understanding how these things work.
Yes, costly. And you describe the lives of essential workers. And you say that if someone tells you that you are essential, your life is not essential. Specifically, the unfortunate events leading to Amazon warehouse worker Ahmed Aden. He contracted COVID, and then you describe this domino effect that it had on his family's life. But he is one of countless Americans, specifically people of color, who continue to be at this huge disadvantage during the pandemic because of their lack of access to healthcare, testing, evictions. How did you learn about his individual story, and what did you hope that your readers would learn from that?
So I think it was more important to tell this book on the ground in story form than it was for me to try to just abstract it and tell it from 50,000 feet. And one of the people who I describe in the story, including people like Jared Kushner and others from the White House, but also some ordinary people like Ahmed Aden, is he got sick with COVID, but because there weren't enough tests and he couldn't get diagnosed, he lost his pay. He had 5 kids, and lived in a 2-bedroom apartment, and had to isolate or quarantine in a way that some of us can quarantine quite nicely, some of us cannot. And he had a child with cerebral palsy, a wife with cancer, and he lost not only his ability to work, but his ability to get paid. And he couldn't get a test. And of course, he lost his health insurance and couldn't afford medical treatment. And Ahmed's was the experience of many, many, many people. At the same time, there's a chapter in the book called The Room Service Pandemic, because there really is a split screen. There are those of us who are able to work from home, isolate, get Netflix, get all kinds of Amazon packages from the work that Ahmed was doing in the warehouse. And most of us did quite fine. And in fact, many of us wondered why the big fuss. Whereas if you lived in Ahmed's community, it was quite different. The entire emergency room and critical intensive care unit were filled out entirely with Black and brown hourly workers. And so there became a point in time when certain of us felt safe and therefore impatient that we had ongoing public health measures. Meanwhile, other communities like Ahmed's were getting devastated. And it was a story that didn't get as much visibility as it should have.
Mm-hmm. Nikki and Geoff, what I found really interesting, one of the points that you made in this book was that you had been researching and covering the topic of an imminent threat like COVID long before COVID was known. This book was actually years of exhaustive research in the making. And in fact, one of the things that you mention in the book is that you were at a simulation exercise conference event, which basically was a foreshadowing about what was about to happen as recently as, I think it was October 2019. So talk to us about that and what from that conference was learned that was actually applied.
unfortunately easier to talk about what was not applied. But yeah, it was sort of a striking coincidence that in fact we were at a pandemic simulation. So these are big exercises that are run for leaders to kind of game out their pandemic response and hopefully to surface any issues so that they can be resolved and lessons can be learned, and we can be more prepared. That's the idea. And Johns Hopkins, which ran this particular one, has run several of them, and sort of we've even attended a few, and then they disseminate the kind of learnings afterwards and people implement them, hopefully. So this one was for a novel coronavirus. Astonishingly, the head of the Chinese CDC, George Gao, was there role-playing this situation. Various other leaders from financial institutions and health institutions, World Bank, etc. And we're all in a hotel room in New York City role-playing what would happen if a novel coronavirus hit the world. As a novel coronavirus was no doubt already circulating in Wuhan. I mean, it's October 2019. So things didn't go very well in that simulation. And as a matter of fact, they never do. These simulations just really reveal a lot of gaps. And they also interestingly reveal the same mistakes again and again. So one thing that we found particularly interesting was that quarantine is always just sort of introduced as a measure to slow transmission, reduce cases, flatten the curve, that expression we heard so much last year. And yet no one thinks about where it should happen, what's going to how people are going to pay their bills, feed their family. The example in Andy's book is a perfect example of someone who was being asked to make a sacrifice for the public good, which is what quarantine is, what isolation is too, and yet not being given the duty of care that comes with that, because no one has thought through the logistics of how do we actually make quarantine as a lived experience fair, reasonable, doable, effective. And that happened again and again. I mean, it dates back to the very beginning of quarantine. There were essential workers in Dubrovnik when quarantine was invented in the 1300s, and they were the only ones who were not allowed to flee the city and go seek safety elsewhere. They were the ones that had to stay there and be exposed to the disease and be monitored by the city, and told how they could move around and so on. So these inequalities go way back, and however many times we have been through a pandemic or simulated a pandemic, we don't necessarily seem to have learned the lessons.
Yeah, and to that, just briefly, I might add that it was interesting that quarantine was often just simply where the exercise ended. So we'd go through a model, they would game out a pandemic, they'd game out exponential spread, and then they'd say, okay, now it's time for quarantine, and that would be the end of the simulation. But no one ever simulated quarantine to actually ask, what do we need? Where are the facilities? And I think you saw that in COVID-19, where we just didn't have the space. We're trying to retrofit hotel rooms. We're putting cots in convention centers. No one knew where we were going to put the bodies who needed to be quarantined.
And you get these transmission across, families who live in multi-generation homes. They can't isolate safely. And that's where most of the transmission occurred during COVID-19 after lockdowns were in place.
Andy, while these two books are discussing the topic of COVID-19 in their own way, one of the parallel themes that they cover is overreach, governmental overreach. Both books discuss mask wearing, for example, as a symbol of either freedom or control, something that seems almost unique to this country. What has been your experience with this as a political statement?
Well, a mask in any public health measure is not inherently political. You can make anything political if you choose to, if the public bites, and that's indeed what's happened here. And look, let me be clear: there's no one in the world loves wearing a mask. That's given our choice, people wouldn't wear a mask over wearing a mask, and that's true everywhere in the world. And there were concerns about wearing a mask and arguments over masks. And in other parts of the world, should they, shouldn't they, etc. But two patterns emerged that were interesting. One that was different here in the U.S. is that it became a matter of political identity, as opposed to just a matter of not liking it or liking it. In other words, based upon your political identity, Therefore, you should feel a certain way about masks or not wearing masks. And that's the fundamental flaw. There may be things to debate about masks and the type of masks and when to wear them and when not. But at fundamental level, they're about protecting yourself and others. The other thing that is a pattern that's emerged is that in parts of the world that have experienced global pandemics before, particularly in Asia and in Africa as well, there is a very high acceptance of mask wearing. In fact, in Hong Kong, even without government advisory, the Hong Kong people put on masks as soon as COVID-19 happened, and dramatically limited the number of deaths to about 100 over the course of 2020, because they took such quick action, even though they were very close to and are indeed the closest transportation hub to Wuhan.
And we were talking about communicating with the public. You've called this book your longest tweet, and you have used Twitter in the same way that you've used your power to fight misinformation in your work. From the beginning, you updated the public on what you knew about the pandemic. And of course, you continue to offer regular updates on Twitter. Similar early attempts of keeping the public informed were swiftly squashed and officials silenced in the media. Can you talk to us about how you address this in your book?
Yeah, so first of all, Twitter should not allow anybody to tweet this much in one tweet. That would, I think, be an important violation of Twitter protocol. Yet there's something about the way you write on Twitter, where you're clear, you're matter of fact, you get to the point. That I think has to carry through to some extent how we communicate with one another. The thing that was, I think, a pretty significant concern that I raised, that was observed in the book, is that any scientist who had any reason to question the narrative that the administration was putting forward was silenced. And some of those examples are very well known in public, but some of them weren't. So at one point in the book, Alex Azar, who was saying that he wanted to go to the public and say that everything was going to be fine, but things could change rapidly. That was the phrase he wanted to add. And even though things weren't fine, that phrase alone drew not only criticism from the White House, but he was pulled from Fox and Friends, and the Health and Human Services Department wasn't permitted to talk to the public again for 45 days. So here we are early on in the pandemic, and the entire department of HHS is not permitted to talk to the public about the pandemic because it countered the narrative that the president wanted at the time. And I think having someone with any preformed narrative, this isn't necessarily about one person, but having any sense that you're going to have a preformed narrative, that you're not going to follow facts and listen to facts on the ground, really doomed us to a fate worse than we needed to have.
What did it feel like to be someone who worked in healthcare as an advisor at the highest level for as long as you have, to be in such close proximity to the leadership at the time, but not able to influence in the way that you would have liked to?
Well, this book details some of those efforts. I picked up the phone early on and called Jared Kushner, who I didn't know, but who we knew each other. We knew of each other, and he was gracious enough to take my call. And it began a relationship and a process that's documented throughout the course of the book, where I tried to get insight into how they were thinking and tried to influence their thinking. I was only modestly successful at being able to do that. And so I turned a lot of my attention to state governors, other world leaders, and others who were kind of couldn't avoid the crisis. But at one point in time, Kushner said to me very bluntly that their political strategy was going to be to allow the president to open up the economy and from then on take no responsibility, and therefore anything bad that happened would be the responsibility of the states and state governors. And I obviously argued with him that was not a good thing to do. But once that happened, it was pretty clear that the only action that we could really count on would be at the state level, and that turned out to be, quite mixed along the way. And by the way, I want to say one thing. Nothing in this book suggests there are either easy answers or does it suggest that people shouldn't be forgiven for making honest mistakes. In fact, I think we should be quite generous with people who are making decisions in the heat of the fog of war without a lot known and to getting things wrong. And that's not the issue. The issue is, are there mistakes that people made that you wouldn't classify as honest mistakes, where they were not acting in the public's best interest? And those are some of the flaws that I think we should hold people to account for.
And you, in your book, you ponder the question of judgment. How would we be evaluated by people in the future, measured by how many people we lost, how many deaths we prevented? What is your take on how we will be judged?
Well, look, I think the first thing we should try to do is judge ourselves and our own actions. I know that our best moments in this pandemic individually were when people did things for others, when they were sewing masks for others, when they were relieving the burden of others, when they were calling people and doing Zoom cocktail parties or something to check in on people. The doctors and nurses that risked their lives, that couldn't see their own kids. There were really these amazing moments. And yet we also have to ask ourselves that there are moments, and I ask myself if there are moments when I put my own safety and self-interest, or even my own interest in just moving on with the pandemic ahead of doing things that would be helpful to others. This was a moment when we rely on one another for our own health and safety. And so, this is a generation we are now several generations removed from the generations that really sacrificed in this country, the generations that have been through world wars, that have lived through Great Depression, and many of them immigrated to this country, many of whom suffered greatly. And there has been a spirit in this country that, yes, individual liberty is important, and choice is important, and freedom is important. We all are beneficiaries of that, but that those things are earned. We earn them when we have a collective good that we look out for, when we build those pieces of our society.
Nikki and Geoff, I'd like to go back to you. In your book, you reminded us about a nurse Casey Hickox, who, after serving several weeks treating Ebola patients with Doctors Without Borders in West Africa, she came back to the United States to a bit of a political quarantine nightmare. And I'd like to know how she has shaped the way we view quarantine in the U.S.
Well, sure. Yeah, it's a great question, and it's also Casey Hickox is a very interesting recent historical figure. I think, speaking for both of us, it was interesting just how wrong we were when we first saw the media coverage of Casey Hickox back in 2014. She was really vilified in the press for being selfish, for sort of being uppity, for refusing not even public health advice, but political advice from people like Governor Chris Christie of New Jersey. Because she wouldn't go into quarantine and was saying that it was unnecessary. She had, in fact, not been exposed to Ebola. She had just simply come from West Africa and had, I think, underestimated exactly how she would be, portrayed in the press, and the kind of, frankly, ignorance that she would receive, or lack of preparation she would encounter when she got back to the United States. To make a long story short, though, what was so interesting about talking to her was that not only was she really, medically or scientifically correct about whether or not she needed to quarantine. And in fact, somewhat ironically, because we now know his name is a household name, Anthony Fauci, Dr. Anthony Fauci, was one of the only people who actually said, no, she's correct. She does not need to go into quarantine for Ebola. She wasn't exposed to it, and she has no symptoms. But rather than, turn this into a kind of an experience where she could sue Chris Christie, which she did, and then walk away with millions, she really kind of made it a moral or ethical crusade is the wrong word, but a fight to have recognized basically the rights of the quarantined, a bill of rights for people who are being asked to take these sacrifices on and to go into isolation. She wanted to make sure that there was a right of appeal, that there was a duty of care, that she really wanted to stand up for, an individual and other nurses like her would not have to go through the same process.
I think she really created a template that, if it was in place everywhere, and if authorities followed it, could be incredible, because all of the issues that people have around trusting public health experts, if there was a transparency that you get with this kind of Bill of Rights for the quarantined, where you know what your rights are, you have a right of appeal, the state has to show it's the least restrictive method, appropriate. I mean, there are all of these things about making sure, again, food, shelter, adequate lodging, all of the, not being at risk of losing your job protection. And then if you make these sacrifices for the public good, well, there's even, a reward in that when there are cures or vaccines, you're in the line. You made a sacrifice and you get the benefits. And putting that in writing and having people understand that they have rights, and that's what these rights are, and they are protected, I think would go a long way to building back some of the trust that people don't have, that leads them to resist what are really reasonable public health measures for the greater good. If people felt like their own individual rights were being assured, they might be more willing to make those kinds of sacrifices that we're asking of them.
It's interesting you mentioned that, because in your book you also describe the utilization of what some might see as extreme quarantine measures. You paint a picture of this dystopian society that really might not be that far off. The days when the sick are locked into their homes may be a situation where history does repeat itself, except in the future it's going to be with technology that actively monitors our browsing history. For example, if we're looking up coughing symptoms or illness symptoms, and then measures our temperature and gives us diagnosis in real time. Smart buildings could essentially lock us in our homes until proven safe, as you say.
Yeah, Amazon, not to bring it back full circle, but Amazon has a patent already for its eavesdropping speaker, to tell if you speak to it, it can track not just disease, but also even signals of depression. So these things, as you say, are already in place, and it's not hard to imagine a future where that's connected to your smart door lock and you're not allowed to leave. And the question we pose as we look to the future of quarantine is, with all these pieces of technology, I mean, in some ways it's great if your speaker can listen to the sound of your cough and say, that sounds like a COVID-19 cough. That's something that MIT researchers have shown can be done with a considerable degree of accuracy. The challenge, perhaps more so, is who is owning that information and what is their incentive for using that information. And of course, if you are a corporation, your incentive is to profit and not necessarily, to create public health. I mean, no one can argue that Amazon's overall goal is public health, just to pick on them again. And so the question is not so much, these technological futures are terrible, but who do we want to have this information, and how do we want them to be able to use it, and what are their incentives? Also, public health officials are incentivized to do things, take actions that will promote public health. Corporations are not necessarily.
Mm-hmm. And Andy, I'd like to go back to you, because you mentioned in one of your chapters, you gave us a peek, obviously, of what was happening at the White House during this time, but also the way the medical and the pharmaceutical industry work against us as they continue their quest for competition. Specifically, the way pharmacy continues this cycle was eye-opening to me. Can you give us a little synopsis about that?
So, look, first of all, we have a incredible good fortune of science and public and private partnership carried out through multiple administrations that has really resulted in spectacularly performing vaccines, and we all ought to be grateful for those things. One of the questions the book raises is how much certain elements of our society prevented us from acting as quickly and as swiftly as we might otherwise. For example, we talked about earlier the difference between how salaried people and hourly people were treated in this pandemic. Our view of listening to experts and relying on experts, the media and social media. And in this particular example, just the very nature of how much our economy is driven by profits of private corporations, and how frequently the administration just didn't want to get in the way of that, would slow to use the Defense Production Act, was loath to get in the way of negotiations that the pharmaceutical companies had at the beginning of the pandemic, which would allow them to charge as much as they wanted for the drug. And we can argue about the merits of some of these things, but I think the basic point, the basic argument is that there's no doubt that we are living in a healthcare system that treats you based upon your income level, your race, and your geography. And I think some people saw that very live for the first time during this pandemic. Likewise, our education system. So if you have internet at home, if you have access to good medical care, and if you have a good job, this pandemic you ended the pandemic in some ways, or the last stage of the pandemic, not so poorly off if you could avoid crowds and so forth. But if you couldn't do those things, if you didn't have active health care, if you had to go out and work every day and didn't have those luxuries, then it was a much more challenging situation.
And Andy, since I finished the book, much has changed, to which I imagine even more has changed since you finished writing the book. So what at this point, knowing what we know now, knowing what you know now, would you wish you could add for consideration from your readers?
Well, it's interesting because I had a rare opportunity after I finished the book and submitted it to the publisher. President Biden asked me to come join the administration, which I agreed to do for the first 5 months. And so we delayed the writing of the book. And my publisher asked me if I would be interested in just rereading the entire book and changing whatever I thought would change based upon actually being in the White House, seeing what was happening, and being in the chair of many of the people in the book that I talk about. And I rewrote in the introduction, the preface, and I wrote a new foreword, a new afterword. But I left the book pretty much as is, because it's intended as a first draft of history on what we all experienced in a way that I think is both personal and reflects the lessons we had at the moment. And I'm quite sure that 10 years from now, 5 years from now, we'll have a new set of lessons. We'll have new things to reflect on. But the power of having kind of a real time description of what we were going through and a kind of look at what all that implies for us. And we don't have a lot of time between now and the next set of challenges. They're already upon us. They're very similar set of things we have to do when we look at what's going on with the climate and weather events in the U.S. as we do with the pandemic. Do we trust science? Do we want to do what's just best for ourselves, or do we want to do what's best for society? All of those kinds of questions, none of them easy, are all the same ones we have to confront here today. So I think it's useful to look at those in this context and think about how do we do better.
Mm-hmm. And going back to Nikki and Geoff, you explain how the structure of quarantining is simply not limited to public health officials, as some might think, but for different reasons. It also affects architects, lawyers, astronauts, prison reformers, and other industries that are deeply affected by how quarantine is structured and used. Could you explain that to us a little bit more about how different industries are so intimately affected by this?
Mm-hmm.
Absolutely. So the sort of third part of our book looks at quarantine in some of these different contexts. And there's some interesting, one of the reasons we wanted to do this is not just because it's fascinating, although it is, but to see how the same sorts of decisions and trade-offs and debates happen in these different contexts. So, the same questions about, we can't slow the economy, we can't damage trade. That comes up all the time with agricultural quarantines. The same questions about the risk, which might seem small, versus the consequence, which might be enormous, existential, comes up all the time. Again, when you look at isolating nuclear waste, tiny risk, existential consequences. The debates about, well, maybe this is just kind of pointless because it's not watertight. The sense that like if quarantine and our public health measures are leaky in any way, well, and some people are not following them, maybe none of us should bother. That comes up in planetary quarantine all the time, where people say, well, we've already brought some bugs to Mars. We know it. We know there's Earth. We know there's life on Mars because we brought it. So why bother? Why continue to make these efforts? And seeing those debates in a different context, even seeing how other species quarantine, because there are other social species, ants, termites, they build architecture. They also deal with these same trade-offs. Do you sacrifice the efficiency of your nest and the ease of moving around and how quickly you can do that to make disease less likely to spread? These are all trade-offs that happen across species and across different spheres. And we wanted to look at them in these different contexts because I think you can see them a little more clearly, maybe outside of the emotional tug of individual human lives and the fear and the value that we attach there.
And even beyond human lives, in one of your chapters, you discuss how vulnerable agriculture is to disease and how precarious our food supply could possibly be right now. And can you explain that to us, how what we know about the pandemic can be used to protect our food supply now and in the future?
Well, sure. I mean, one thing I might say just right off the bat is that, it seems pretty clear that our food system is at as much risk as we were prior to COVID-19. The big pandemic for agriculture, it seems to be on its way, and I think we would do well to be more prepared for it than we currently are. As one person says in the book, we're only one pathogen away from starvation. It was a bit of an exaggeration, but nevertheless shows just how vulnerable it might be to not only grow the food, but then to actually ship it to people, to store it, to actually put food on plates. But so we do actually go to a number of different places to look at, the risks to the food supply. In one place in St. Paul, Minnesota, we went to a USDA lab where they're researching a wheat rust, a disease of wheat that could actually dramatically affect harvests, not only in the United States, but around the world, where people are actively tracking the spread of this particular germ. And as it's affecting, wheat in Central Asia, creeping into Africa, and then potentially hitting the United States. One example that maybe might be good for illustrating just how fragile things are might at first sound flippant, but actually we went to the International Cocoa Quarantine Center, which is actually where cacao plants that produce chocolate need to be quarantined before being shipped around the world for agricultural experimentation or grafting or replanting and that kind of thing. But so all chocolate, is at risk of potentially, enormous numbers of different diseases that could wipe it out. And, people were actually warning us about an impending chalk apocalypse, or the disappearance of chocolate, where it will become, as rare and as expensive as caviar. So, of course, that sounds kind of silly. It's just a dessert, it's a sweet extravagance for some. But, you can imagine the same kind of thing hitting, the pork supply. There is a lot of concern actually about African swine flu eliminating huge amounts of pork herds all over the country, all over the world, excuse me. And these kinds of things, to make a long story short, really do seem like kind of the next pandemic might actually be hitting our food supply rather than us directly.
One of the fascinating things in that chapter is actually an example of how automated quarantines of the future are actually working to protect in these kinds of ecosystem contexts rather than human life. And it gave us an example of how that kind of thinking could be used for human quarantine. So this is something that Chevron, bizarrely enough, the energy giant, has pioneered for an island off of the coast of Australia, completely pristine island. It's like Australia was before white people arrived. And so fabulously diverse ecosystem. And the only reason they were allowed to drill there for the natural gas that lies beneath it is if they agreed to keep it pristine. And to do that, they had to invest a huge amount of money in a really innovative quarantine management system. And there were so many things in there that we could take away. I mean, on the agricultural front, they redesigned shipping containers to make them much less of a risk of bringing pests and diseases as they travel around the world. Well, not only could we redesign shipping containers, and should, their containers are same price and just don't carry the risk of importing disease. we can apply that kind of logic to how we travel around the world too. What could be designed about what the containers we travel in? They gamified quarantine training. So they created this computer game called Quarantine Hero to train the quarantine inspectors, which everyone loved. Turned into a huge contest amongst the quarantine inspectors. Now the Chinese border force are using it to train their inspectors. But again, we know psychologically what it takes to make these things fun. Why can't we apply that to the quarantine experience here? Gamify it, incentivize it, give people the nudges they need. We know psychologically how to do this. And the interesting thing about what Chevron is doing is it is applying some of this detection technology, acoustic sensing, but it's doing it in a really smart way. And that's something we could learn from.
It sounds like we know that there's quarantine systems that are very successful, but you also write that we can't get quarantine right, only less wrong. So how is that? Explain that to us.
Yeah. Well, yeah, I'd say that, that comes back to the idea that quarantine really is fundamentally about just buying enough time to have sort of, the real response. You're waiting until you can develop a vaccine, until you can understand how a disease is transmitted, until you develop a cure or the appropriate medical response, or in other industries, the right form of isolation or the right response to a plant pathogen. But the quarantine is really this thing. It's an intermediary kind of stopgap measure. You're simply keeping things separate for long enough until they're proven safe or until we are. But in the meantime, you develop these other responses, these other ways of keeping things secure and keeping things safe.
It's never going to be the perfect solution, but we're always going to need it, is where we end up in our book. And so let's do it better going forward, and let's not fall into all of the obvious traps. But yeah, it's always going to be leaky. It's always going to be applied with some degree of unfairness because it's based on suspicion. And when you have suspicion, you have bias. And it's always going to, we can do a lot to make it better, but we can't do everything.
And this is a question for all of you, please. What are some of the lessons learned for the next pandemic now that we have this real world data? I know we're not done with this pandemic yet. However, what can we best now apply perhaps as prepared society for the next one? Andy, can we start with you, please?
Yeah, I'm still reeling from that chocolate thing. I'm sorry. I don't know if I'm going to recover from that.
Sorry to break the news.
Similar
What's that?
Sorry to break the news.
Yeah, chocolate-geddon. You just don't give me red wine again, or it's gonna be a really bad day. So look, the lessons, the thing that I think we have to understand is that people who have experienced pandemics before respond to them better and more quickly. The other thing we know about countries that have done better is that if you were to graph countries by their wealth against how many deaths there were from the pandemic, you'd find that wealth had nothing to do with it. If you were to graph pandemics by how far apart the top 20% income earners are from the bottom 20% income earners, you'd find that the closer that is, the better the response has been. The better in terms of fewer deaths, better in terms of less economic pain, better in terms of less people who are less upset about having to take measures. So, there are lessons about who we are as a society that don't get changed just by one pandemic, but I think wake us up. So there are things like, for example, in the American Rescue Plan that created a child tax credit so that families could afford to take care of their kids and work. Believe it or not, those are more impactful steps towards being able to respond to a pandemic, and more importantly, to the time between now and when we would have our next pandemic, because they increase everybody's quality of life. So those sorts of things I think are important. There's obviously a series of technical things we need to do better around making sure we have enough ventilators and masks and vaccines and so forth. I think we'll do better at the technical stuff. The things that we really have to focus on are the questions about who we are as a society and who we want to be. And is this the kind of response we want to have next time?
Geoff and Nikki?
Yeah, I would 100% agree with that. We say toward the end of our book that there is no public health without a public, and building that equality and a sense of public duty and responsibility rather than individualism is what's going to make this work or not. But I would also say there's a sense of trust that needs to be rebuilt. And part of that trust is going to have to involve communicating uncertainty. Politicians especially hate uncertainty. It just doesn't sound good. It sounds weak. But that's how science works. And particularly in the case of an emerging disease, that's where we are. We're in a condition of uncertainty and things will change. As Andy said at the start, things are going to change fast. And being able to communicate that in a trustworthy manner is something that I think it would really help if our leaders had some practice at and got better at to build up that fund of trust.
Yeah, and I think to everything said so far, I'll just briefly add that specifically in terms of quarantine, I think we saw again and again in our research in quarantine history is that quarantine is one of the first things people forget about. They tear down the quarantine station because the disease is over, or it was a temporary facility to begin with. But people move on, they sweep it under the rug, and they don't want to think about what they've been through, precisely because it was not an exciting experience. But so now is the time actually to really focus on quarantine specifically for the next time, so that we do remember what went right for some people and what went wrong for most of the others. How we can prepare for it legislatively, economically, personally, even emotionally, and certainly architecturally, to make sure we have the spaces for people to be quarantined and isolated. So I just think that that would be one practical solution to making sure that when the next quarantine hits, we're actually ready for it and we can do it equitably.
Thank you. Thank you so much to Nicola Twilley, Geoff Manaugh, and Andy Slavitt for joining us on this panel today. Congratulations on your books and giving us a look into different settings related to the pandemic. We got a peek behind the political curtain and a history of how we dealt with biological threats to our health. Thank you so much.
Hello, I'm Jose Cruz. I'm the CEO for the San Diego Council on Literacy. We work with a network of 29 youth, adult, and family literacy programs that annually serve 160,000 residents of all ages at no cost. Our mission is to unite the community to support literacy. It's an exciting year for us. It's our 35th anniversary. It's also the 5th anniversary of the San Diego Union-Tribune Festival of Books. The San Diego Council on Literacy is a beneficiary of this event. So when you participate, you support literacy, especially through the author panels and just in general. So when you participate in this event, you also make it possible for another person, a child or an adult, to improve their reading and writing skills so they can read the books that you read. We have our favorite event activities. We like the Storytime Hour, and you probably have your favorites too. So we hope that you'll join us at the San Diego Union-Tribune Festival of Books and learn more too about the work of the San Diego Council on Literacy by going to literacysandiego.org. Thank you.